Hey, you there, you right there. Stop what you're doing. Do not even think of starting your GLP-1 medications like semaglutide or tirzepatide without watching this first. Well, maybe you can think about it, but definitely take a look at this video and you can read the resources I've dropped in the description below, and so you can get a deeper understanding of what's happening with these medications before you get started. Welcome once again. My name is Dr. G, and I'm an internal medicine physician in Hollywood, Florida. I specialize in lifestyle modification coaching and patient education. So if you've watched any of my videos, any number of my videos so far, you'll know a little bit about GLP-1 medications, also known as glucagon-like peptide 1 agonist medications. And these are some of the examples, such as semaglutide, which comes in 2 different flavors, Ozempic and Wegovy. Liraglutide, which comes in 2 different flavors as well, Saxenda and Victoza. And one of the fan favorites is the tirzepatide, which comes in Zepbound and Mounjaro. There are others, of course, and you know they are increasingly becoming more and more recognized as potent tools for weight loss, particularly for those who have struggled finding lasting success with diet and exercise alone. Originally developed for the management of type 2 diabetes, as you know, these medications have shown significant weight reduction benefits, revolutionizing the treatment landscape for obesity, which is a much needed area of medicine. As patients consider starting GLP-1 agonists, it is essential to be informed and prepared for optimal results. This guide that I've outlined especially for you outlines 8 essential tips for patients before starting treatment and supported by scientific evidence. So let's get right to it. Number 1, understanding the mechanism of GLP-1 agonists and how they work. Quick tip, familiarize yourself with how these medications function in order to set realistic expectation. The days of simply ingesting medications without understanding how they work are long gone for your patients, for all patients in this day and age. Your doctor should be able to explain what I'm about to tell you, or you're going to need to learn it on your own. Luckily for you, this video counts as learning it on your own. GLP-1 is an incretin hormone produced in the gut of the human being upon eating food. And this plays multiple roles in regulating glucose metabolism and satiety, which means being full, feeling full. By mimicking the action of GLP-1, the GLP-1 agonist medications enhance insulin secretion. They suppress glucagon release, slow gastric emptying, and promote satiety. This all helps patients to feel fuller for a longer period of time, and in the end, losing weight. So the dual effect on both glucose control and appetite suppression makes them ideal for managing weight loss, especially in individuals with metabolic disorders. So the clinical trials that they've gone through, such as the STEP program, which is semaglutide treatment effect in people with obesity, this trial demonstrated that semaglutide resulted in an average weight loss, get this, of around 15 to 18% over 68 weeks. Significantly greater than lifestyle changes alone. The tirzepatide trials also showed even more weight loss of about 20% in about the same time frame. Number 2, adopt a comprehensive approach. Some of my colleagues don't like it when I say this, but I'm going to say it anyway. In my mind, the medication is just one tool in your weight loss journey, and it's not necessarily needed for the rest of your life. Doesn't have to be a chronic medication. So the tip, combine GLP-1 therapy with lifestyle changes like diet, or I like to say nutrition, and exercise for the best outcomes. While GLP-1 agonists can reduce hunger and assist with your weight loss, they are most effective when integrated into a broader lifestyle modification plan. This includes a balanced nutrition, regular physical activity, and behavioral interventions to support long-term success. Medications alone can only go so far. Sustained weight loss requires changes in caloric intake and an increase in physical exertion. A study by Wadden et al. In 2019 in a journal called Obesity Reviews revealed that patients who combine GLP-1 therapy with a reduced calorie diet and increased physical activity achieved greater weight loss than those relying solely on medication. Additionally, Establishing healthy habits while on medication can aid in maintaining weight loss after discontinuing the drug, which is my plan from day one when I first sit down with my patients and formulate a plan for their lifestyle modifications and set realistic goals. Tip number 3, start low and go slow. Manage side effects effectively. The tip, begin with the lowest dose to reduce the risk of gastrointestinal side effects and all side effects from the GLP-1 agonists in general. GLP-1 agonists can cause nausea, vomiting, and diarrhea. Also can cause constipation, but particularly at the start of treatment. These gastrointestinal side effects are often the primary reasons patients discontinue therapy. So to minimize these risks, the dose is typically titrated gradually, starting with a low dose and increasing over time. In my office, we continue to rarely need to stop GLP-1 agonists due to unwanted side effects. And the reason I feel this is happening here, or not happening, is because we go slowly with the medications and we check on our patients for progress on a weekly basis. Finally, I do not believe every single patient needs to be on the highest dose. Currently, of the 100 plus patients I've seen on these medications and treated and managed through them, only 2 needed max dosing. So what does the evidence say? A meta-analysis published in Diabetes, Obesity, and Metabolism found that slow dose escalation significantly reduced the incidence of gastrointestinal side effects without compromising the medication's effectiveness. Means going low and slow is actually the way to go. Patients should work closely with their healthcare providers to adjust the dose based on their tolerance and therapeutic response. Meaning, if we're getting to where we need to go with the lower doses, we don't need to go higher. All you're chasing at that point is unwanted side effects. Tip number 4, hydration and nutrient intake. Pay attention to fluid and electrolyte balance. The tip, stay well hydrated and monitor nutrient intake to avoid deficiencies. GLP-1 agonists, by slowing gastric emptying and reducing the appetite, can inadvertently lead to reduced food intake, which may then cause nutrient deficiencies if not monitored closely. Additionally, due to the common gastrointestinal side effects, dehydration is a real risk, especially in the first few weeks of the treatment. Therefore, patients should focus on drinking plenty of fluids, especially water, and may benefit from electrolyte supplements if they experience prolonged vomiting or diarrhea. They should also ensure they are consuming nutrient-dense foods, rich in vitamins and minerals, to support their overall health. Consulting a dietitian can help in formulating a plan that maintains adequate nutrition while reducing caloric intake. Number 5. Let's be real, set realistic weight loss goals. Here's a tip, aim for steady, sustainable weight loss rather than quick results. There is no doubt, the science is clear. GLP-1 agonists are highly effective, but they are not a quick fix. They are not a magic bullet. Weight loss with these medications typically occurs gradually over several months. Patients who set overly aggressive weight loss targets may become frustrated if they do not see immediate results. A loss of about 5 to 10% of body weight is associated with significant improvements in metabolic health, including reductions in blood pressure, cholesterol levels, and insulin resistance. What does that mean? Even though you may not feel like you look the way you want to look, your labs and your longevity is already thanking you. It's important for patients to set achievable goals and understand that the medication works best in the context of a long-term commitment to health. Not the medication, to health. Clinicians should emphasize, doctors like me, should definitely emphasize that slower, more sustainable weight loss often leads to better long-term outcomes. Number 6 is often overlooked, but not at my office. Monitor your mental health. Address psychological aspects of weight loss and weight gain. The tip, keep mental health in focus, especially as weight loss progresses. The need for weight loss especially when it is significant, can bring about psychological changes. Some patients may experience improved mood and self-esteem as they lose weight, but others may struggle with the emotional aspects of changing body image or face challenges related to weight stigma or past trauma related to eating, which cause them to have a problem with their food relationship and therefore have them have issues with actually losing weight, getting over those emotional problems. Moreover, GLP-1 agonists have been reported to influence the reward pathways in the brain, which can potentially alter cravings and eating behaviors, which is an added benefit of the GLP-1s. For some patients, this change may reduce emotional eating or cravings for highly palatable foods, while others may need additional support to navigate these psychological shifts in mindset. Patients should maintain open communication with their healthcare team regarding their mental health. Your doctor should be considering referring you or whoever it is that's on a GLP-1 agonist to counseling or support groups. The support groups can be internal or they can be an external group or someone that you or a group that you put together on your own. This is particularly helpful for those with a history of eating disorders or body dysmorphia. Tip number 7, may not be what you want, but it may be what you need. Prepare for long-term use and maintenance. The tip, plan for ongoing therapy or consider maintenance strategies after discontinuation. This is a common discussion that I have with almost every patient that starts the medications in my office. How we're going to land this plane and how we're going to maintain this plane at this weight. GLP-1 agonists are typically most effective when used long-term. We know this already. Evidence suggests that many patients who discontinue these medications may regain some of the weight they lost. For example, a follow-up to the STEP 1 trial found that patients who discontinue semaglutide regained 2/3 of their weight loss after 1 year. Wonder why that was. I firmly believe these folks did not buy in fully into the lifestyle changes they could have bought into and could have formed while in the clinical trial. Think about it. The motivation for people to join a trial may not necessarily be because they want to lose weight. They may have joined the trial for other reasons, and the medication being studied is just secondary to them, right? So your motivation needs to be your why. You're trying to do this. You need to find out what it is you need to get to the other side and keep that going. So this highlights the importance of viewing GLP-1 agonists not as a temporary solution, but as part of a broader long-term weight management strategy that at some point, if discontinuation is necessary, patients should work closely with their healthcare provider to implement other strategies to replace the medications, such as continued dietary interventions, increased physical activity, and behavioral therapies to prevent weight gain. So it's not just get on the medications and you're cured, it is get on the medications, help you lose weight, and replace your bad habits with new, better habits. Tip number 8, use safe and effective medications. Essential tip, make sure if you are not getting branded medication from the original manufacturer, that you are getting your medication from a trusted and a reliable source. It is absolutely essential to make sure that the medication you are injecting is what you think it is, whether that's tirzepatide or semaglutide or whatever other GLP-1 medication or any medication for that matter. The only way to be sure is to use reputable compound pharmacies if you're not getting it from the branded manufacturer. And how do you know if they're reputable? Look them up. This is the best time to go ahead and Google. Ask your trusted doctor for recommendations as well. Stay away from deals that feel like they're way too good to be true, because they probably are too good to be true. I've done a video on compound pharmacies and how to verify them. You can find the link to that video in the description below. So, if you've gotten to the point that you want to start a GLP-1 agonist medications, first of all, I want to congratulate you for taking that step into a better and healthier you by losing weight and changing your lifestyle. It can be a highly effective strategy for weight loss, but it's going to require careful preparation and a comprehensive approach. By understanding the medication's mechanism, combining it with lifestyle changes, managing your side effects, staying hydrated, setting realistic goals, monitoring mental health, planning for long-term use, and getting your medications from reputable sources, patients can maximize their chances of absolute success. Weight loss is a journey, and GLP-1 agonists can be a powerful ally in that journey when used correctly and with appropriate guidance. I know you now understand to achieve and maintain any lifestyle modification goal, you should highlight the need for a holistic approach to weight management. That goes beyond pharmacotherapy. GLP-1 agonists offer a promising path for patients struggling with obesity, but as with any treatment, success depends on consistent follow-through, informed decision-making, and collaboration between yourself and your healthcare provider. So, if you are starting or restarting or at the beginning of your weight loss journey and you need to calculate something as complicatedly simple as your total daily energy expenditure, BMI and all your macros, and get an idea of what your macronutrients should be, I've designed a free calculator that you're free to use, and that makes that important task super simple. Check out the link in the description below to get started. And once again, thanks for watching, and remember, health is a journey, not a destination. Take it one step at a time and stay informed. Stay healthy, and I'll see you soon.